that many councils aren't paying home care companies enough to cover basic costs such as travel between clients. It comes from a new report by the Homecare Association, which calculated an average hourly shortfall of £3 per carer. Councils say they don't have enough money to pay companies more. Last week, the government announced £162 million of new funding for adult social care. Our social affairs editor, Alison Holt, reports.
For 16 years, Denise has been driving around South Yorkshire caring for people in their own homes, whatever the weather.
Doing my job, it's great reward, great satisfaction. Every day is different. You meet different people, different circumstances.
Her company looks after a lot of people paid for by their local authority, but today's report says many councils don't cover the real costs of care, including travel time. She loves her job but understands why many are put off.
You recruit people, but when they go out there and they realise that you're getting up at 5 in the morning, you sometimes won't get home while 11 at night, you might nip home for 5 or 10 minutes. The money doesn't be level with the job for what you do out there, and then they just go elsewhere where it's more money and it's not unsociable hours.
How's your interviews gone this week?
Had a couple, a few not turn up.
Back in the office, they've had to hand back some council contracts because they can't recruit enough staff. They want to be able to offer more pay.
Right now, I think we're about 25% underfunded. That 25% would, yes, it would address the terms and conditions that we need to look at for our amazing care workers, but it would also mean we could invest in our office teams, give them some more support for the work that they're doing, and look at other methods. We're miles away at the moment in terms of the rates that are being paid.
The association representing UK home care companies calculates that the minimum cost of an hour of home care is £21.43. That covers the minimum wage, pensions, travel, training, backroom staff and 62p for profit or investment. But on average, UK councils and health and social care boards pay £18.45 an hour, with one local authority paying just £12.68.
The people who suffer are the staff and the people that they support, because it's very difficult to pay them any more than the national legal minimum wage, and sometimes they may not even receive that for all working time if travel time isn't properly covered by that amount.
Councils say they hope government reforms will improve the fees they pay for the support needed by people who are older or disabled, but they aren't sure the promised money will go far enough. Alison Holt, BBC News.
Well, Jane Townsend is the CEO of the Homecare Association. You saw her there in Alison Holt's report, and she joins us now. Very good morning to you. Good to have you with us. Tell us a little bit more about what you found.
Well, we submitted inquiries to 340 public organisations across the UK, and are very grateful to all of them for responding. And what we found was substantial underfunding, underinvestment in home care. In the worst cases, there are at least 24 public organisations paying fee rates of less than £16 an hour, which makes it almost impossible to be fully compliant with employment and care regulations. And at a time when demand for home care is rising, we're experiencing the worst difficulties recruiting and retaining staff that anyone can remember. And we're also hearing today about the NHS receiving a further £6 billion funding. And obviously that's welcome for the NHS, but everybody needs to understand that operations are being cancelled, clinics are being cancelled because hospitals are unable to discharge people back home, back to the community because of lack of capacity. So we need to look at the entire social care and health landscape together and not just throw bits of money here and there that aren't going to address underlying issues.
It's interesting because the news also comes, the AA, the motoring organisation, has just announced that the average UK petrol price reached a record high of 142 pence a litre on Sunday, and diesel is a little off its all-time high. So clearly costs are getting more expensive, aren't they? But as you know, there are funding pressures everywhere, and councils say they just don't have enough money to pay companies more. What can be done?
Sure. Well, councils depend on central government for their funding. 70% of home care is purchased by the state, and every business has to work within its budget, within its means, and providers can't pay staff more than they receive for the care that they're asked to deliver. So what we need to see is central government funding social care properly. The NHS is probably up to close to £160 billion of investment from the government. Councils in total receive 22 billion, which is a tiny fraction. And with that, they've got to support thousands more people in the community. So we need to see councils being funded properly, and then they in turn passing that money on so we can give care workers the fair wages that they deserve and require to recognise the skill and experience that they bring to their roles. I think it's also worth pointing out that it saves money long term for the health and care system to keep people living well at home, avoiding unnecessary admissions to hospital. So that's what we really need to do what countries like Sweden do and invest in people at home and in the community.
Can I just explore what you were saying about government funding there, so I make sure that I fully understand this? Because the government says this new £162 million fund, which you mentioned there, will help bolster the home care workforce. You seem to be implying that actually only a fraction of that money will go towards solving that problem. But there's also going to be the new social care levy, isn't there? And they say that will help as well. Is this just not right?
The 162 million is a recent announcement. That works out at about £100 per care worker. So that isn't really going to address these massive differences in salary. So many care workers, if they're lucky, are getting £8.91 an hour for which is the legal minimum. We need to see it much closer to £11.14 an hour, which is equivalent to band 3 roles in the NHS. The social care levy, which they announced in September, is 5.4 billion over 3 years, starting in 2023. So it doesn't even start for a couple more years. And that too works out, that's only 1.8 billion a year for the whole of social care. It's just nowhere near enough. Other organisations like Health Foundation have estimated that we'd need at least 14 billion a year to come close to addressing some of the issues. And what we're seeing at the moment is a lot of unmet need. People approaching councils unable to access the help that they require. And then we end up waiting until there's a crisis. They end up in hospital where we already know the hospitals are full and can't discharge people. And it's just not, it's not a sensible way to go about running a health and care system.
OK, Jane Townsend from the Homecare Association. We must leave it there. Thank you.